Let's bring the Senate Appropriations, Health and Human Development Subcommittee to order. And I think we have the room till 9, but I would love to not take it up until 9. Chairman Tillery, let's do that. Do you mind opening us up in prayer? Senator Kirkpatrick, you're on number 5.
Dear Heavenly Father, thank you for bringing us here safely for another day of work. And you know that we're tired and stressed out, so please give us calm, strength, and comfort. In your holy name, amen.
Amen. Thank you. The Chairman Tillery was asked each of the budget folks to at each subcommittee hearing. It says, lead off your hearing with a question to the participating agencies on the agenda. So given that the House passed a budget that had inclusion of items of an ongoing operational nature that was around 1% above what the governor's revenue estimate was set to accomplish, what areas in your agency's budget might exist that will assist the state in identifying 1% efficiencies and budgetary reductions? So that's a question that goes to everybody in the room and in the audience. And so we're going to lead the way here, and you don't have to answer that question immediately. I'm not asking you to do that, but you know, our turnaround in the Senate is going to be quicker. So we'll be going to finalize some of these things later this afternoon, tomorrow, and then end of the week it's going to move fast. So we would ask that you at least get us information either later today, either later today or tomorrow, early tomorrow. So, having said that, you've seen the agenda. We're going to just go straight down the line. Department of Behavior and Health Developmental Disabilities. Commissioner, welcome this morning.
Appreciate being here. I don't know if the clicker's up here somewhere. Oh, I see it. All right, thank you, Mr. Chairman. So this first section, unless anybody has specific questions, as you're going to see this in all the budgets, it's just the statewide adjustments that was made in the governor's office. No changes in this from the House budget. Next is our addictive disease section. This is the couple of changes there from the governor's budget. The hepatitis C screening was removed in the governor's proposed budget. And it has been put back by the House, so that's zeroed out. So that was a $232,081 add by the House. We also had a $1 million add, increased funds for alcohol use disorder support. This is a really successful program at Northeast Georgia Medical Center in Northeast Georgia. This is a peer program that's been going since, I believe, around 2018. There's good data that's tracked on this program that shows it has significant reduction in Medicaid cost and has proven to be successful. Some of their federal funding is actually going away, so in order to keep the program current, they would need about $1.3 million. So the House has placed $1 million in that budget. I know Senator Eccles and others are very familiar with that program since that was started by the hospital there in their community. So this is under our adult developmental disability section. The first item you see there is to annualize a now comp waiver. This is the IDD rate study that you all led on last year. This is the amount that's needed to annualize that out. That was in the governor's budget, unchanged in the House budget. And then the next item, 64.5, Senate line 64.5. This annualized 100 new now comp waivers that was in the FY25 budget. As you know, it's standard to do half the cost in 1 year and then annualize that out the following year. Again, no change in the House budget from the governor's recommendation. The next item, the governor had recommended 100 new now comp waivers for FY26. The House added 50 additional slots, which brings the total to 150 additional slots at just under $3.5 million. Next item, unchanged from the governor's budget and the House budget. This is to annualize the funding for the Macon Crisis Stabilization Diagnostic Center. That's actually going to open in May. It's in Macon. It's a one-of-a-kind facility. We've talked about that before, and this is the funds to annualize that. Again, no change in the House budget from the governor's budget. And then increased funds for citizen advocacy, expand services. This was a House ad, and this is a citizen advocacy group that connects individuals with developmental disabilities to volunteer citizen advocates who provide freely given independent support. Includes employment opportunities, health care access, social integration, and transitioning out of institutional settings. This would fund 6 new matchmakers to pair individuals with dedicated citizen advocates. And again, that was an ad in the House budget, not from the governor's budget. So next is our Forensic Services Division. First item you see there is annualization of the Dodge pilot program. That is up and running. We've got our first inmates in that facility. That's a total of 30 beds. This is to annualize that funding. That project thus far is going extremely well. As you know, we've got a significant backlog of over 800 individuals in jail waiting over a year to get into one of our hospital beds. Next item is the same, for the same purpose as skilled nursing facility, increase in beds at our Atlanta Regional Hospital. It says 20 beds. We're actually going to be able to bring online 16 or 17 beds. The staffing number's the same regardless of the number. We have room for a total of 20 beds, but we're going to have to add a couple of additional bathrooms to be able to bring all 20 beds online. Well, that's going to cost some additional dollars, so we're going to bring about 17 of those on now. That is underway now. The renovation's underway now to get that facility ready to open. We have a lot of individuals in our state hospitals that really need a nursing home level care. It's very difficult to find private placement for these individuals, so this will allow us to open up some of our forensic beds in the hospital and move some of these individuals out. Next item is to operationalize a new Project New Hope. Our first Project New Hope opened at the Savannah Hospital. It has, it's half full now. We're bringing new people on. Joint Commission is actually there this week. They're our accreditation body, and they're doing it there for their annual assessment, and we wanted to open it up half full, let them come in, take a look at everything, and then once they leave, we'll do whatever they've recommended, and then we'll completely operationalize that. But this one would add 30 additional beds at our Columbus campus. Again, much needed with our backlog in the system. This allows us to step people down that's been in the hospital for a long period of time that really clinically are ready to get out, but the courts are reluctant. These are individuals in the hospital by court order, typically people who've been found not guilty by reason of insanity. The next item there is $1.9 million. That is to operationalize 17 beds at Central State Hospital in Milledgeville. Those beds are open, and this is to fully operationalize the funding for the staffing there. And again, this is also a similar project. Operation New Hope is a step-down type program at Central State. As you can see, our goal is to try to squeeze every bed we can out of our existing system to be able to help with the backlog of individuals waiting on services. The last item there is $185,420. This would be some funding for NAMI that was added in the House budget. The other items obviously were in the governor's budget. This would be for a Henry County pilot program. It's a diversion program from jail. We're doing a lot of work. Many of you know Judge Amaro, who's taken senior status now. He's heavily involved in this work, and we've had numerous meetings with him. This would be a partnership between our agency, NAMI, Henry County Court System, Henry County Commissioners, and McIntosh Trail, our CSB there. And this would be to provide some funding for that project for NAMI. Next is our adult mental health services, 66.3. This would reduce funds for merit system assessment to reflect corrected salary data. Again, no changes between this and the governor's budget. Next item would be this is the rate study to fully annualize the rate study that was done on the behavioral health side. That you all funded last year. Again, no changes between the recommendation from the governor and the House. This next item is something that I know that I'm proud of, and I think that I can say the same for Commissioner Cars at DCH. Russell and I have worked a lot on this and our agencies, and we've tried to identify areas where there's duplications in our processes, because we get a lot of complaints from providers that have to go through our agency and then they have to go to DCH and do the same work. This is an area where we are able to streamline that process. So our two agencies work together along with the governor's office, and the governor approved for this process to be transferred from DCH over to our office. So this is just picking up the existing funds that exist in DCH's budget, move it over to our agency. We're currently going through this process now of creating the rules changes, et cetera.
We don't want you to filibuster the whole, the rest of the room, so if there are not changes, or maybe we can sort of streamline this a little bit, if you don't
All
mind,
right. Yes,
Commissioner Tanner.
Yeah, so all of that's still the same from the governor's office. The next few items are added from the House: increased funds for outreach in the city of Atlanta, homeless, community action teams, and the housing voucher. The one that I will mention there is the housing vouchers. You know, that's part of our DOJ settlement agreement. The House added some funds there. And then the last item, in accordance with our bed capacity plan that was conducted. This is a new behavioral health crisis center in the North Fulton area. You all placed funds in the budget last year at $500,000 to start the planning process for that. Also provide some funds for autism centers. Part of this money would go toward the Marcus Autism Center in Atlanta, and the other to a facility in Savannah. And then under Child and Adolescent Mental Health Services, increased funds for the Gateway Child and Adolescent Crisis Stabilization Unit in Savannah, no changes. And psychiatric residential facility discharge planning, that was an add to the House that they added. Happy to answer questions at the end if there are any on that. And then the last is, you know that there was a study done by the Building Authority that showed we needed about $80 million in renovations at all of our campuses. The governor's placed $68 million in the budget last year that you approved. This brings the total of that to $78 million. And I know that you all should have the recommendations for our 1% cut if that becomes necessary, already been given to you. So if you have any questions on any of that, I'll be happy to answer them, Mr. Chairman.
Follow up on the now and comp waivers. What's the capability of the DBHDD to handle the numbers?
We're staffed up that we could do between 700 and 900 easily a year. I would say 900 is a good place to be. We typically are rolling off 400 to 500 people a year. So in other words, we're losing that many. So without any funding, we would be able to enroll 400 to 500 new people. So in an ideal situation, if we had 400 to 500 new waivers, that would be our optimal enrollment with our current staffing.
Thank you.
Yes, sir.
So number 5.
Thank you, Commissioner. You and I have talked before about the now comp waivers and sort of updating the way that those are viewed in terms of people who are on the list, but they may not need services now, they may need services later. Could you just briefly speak about that?
Yeah, there's been a work group that Ron Wakefield's put together. I know you've been involved in that extensively, and they have been going through that process with a guidehouse and outside national consultant. We're in the process of redefining the wait list so that we can divide that up into some categories, because it's a planning list, but some of those folks need waivers today. Some will need them in the future. Some folks on there may be 6 or 7 years old, don't need services today. That's in process. We should have that completed by the end of this year. We also are looking at the possibility of a new type of waiver, because a lot of folks on the list don't need the full now or comp waiver. So all of that's being explored currently. And thank you for your help in that area.
Are y'all involved in the Kenny A file, or is that with Department DHS, or how's that working?
Now, our attorneys may be involved in those conversations, but no, I'm not. We're not.
Okay.
I'm not that familiar with that. No, sir.
Okay. Any other questions? Thank you,
Thank you,
Commissioner
Mr. Chairman.
Tanner. Appreciate it. And who's next here? Yeah. Georgia Council on Developmental Disabilities, and then DCH is next. Okay. Thanks.
Good morning, Chairman Watson, members of the committee. Nice to see y'all this morning. I think we can be pretty short and sweet here. I'm Darcy Robb, and if there's anyone I don't know, I have the pleasure of being the Executive Director of the Georgia Council on Developmental Disabilities. Thank you for this opportunity today. So our mission here at GCDD is to bring about social and policy changes for all Georgians with developmental disabilities and their families to live, learn, lead, work, play, and worship in their communities. Something that's really unique about us is that we are an independent state agency, and we're actually governed by a council of our members. So our governing decisions come not from any official, but they actually come from our members, over 60% of which are Georgians with developmental disabilities or family members of Georgians with developmental disabilities. The remaining members are state agency representatives. So that's something that I think gives our voice a very unique flavor, is that we actually get our governing decisions from Georgians who live life with developmental disabilities, along with the state agency experts. Our budget, not a whole lot to talk about this year. The only item you will notice that is new might seem like a bit of a blast from the past, and that is a COLA. Please be assured this is not a double dip. Our agency, because the bulk of our salaries are federally funded, historically when the governor has given state employees a COLA, those COLAs have not gone to employees whose salaries are federally funded or grant funded. It's been only for state funded salaries. The governor's office and OPB, we've had some conversations about that. Last year, I was not able to give my staff COLAs. Our federal funding just would not allow it. So with one exception for a federally funded salary, my staff went without. I want to thank them again for their grace in accepting that situation. But I'm very happy and appreciative of Governor Kemp for adding those COLAs in for my staff this year. You can see that's where that 38,000, sorry, my eyes are not what they used to be. But that's where that $39,656 comes from. That is simply giving my staff what other state employees received last year. Again, appreciative of that, would appreciate your support as well. The last thing is I would be remiss if I did not thank you, Chairman Watson, and the many other members of the Senate who have signed off in support of more now comp waivers in next year's budget. We greatly appreciate that. As you know, the need is very deep, and I appreciate the questions earlier. That is all I have, unless y'all have any questions for me.
3, Senator.
Good morning. Thank you for your leadership and your work and your presentation. Are you all on any, given the federal dollars that have flowed to you, what signals are you getting from Washington? Sure, you're staying up late and getting up early trying to sort that out about what could get cut, wind up on the floor up there from the.
Sure.
Dollars.
Are you thinking more in terms of our direct funding or Medicaid and other funding streams?
Well, those of course are taking a huge whack if things go as they intend. But whatever you think is it coming directly to your agency, impacting your agency.
Sure. No, thank you, Senator Orrick. I appreciate that question. So, we are keeping closely abreast of the situation. For the CR that just passed on Friday, The only impact to that area of the budget was the area of the budget that funds GCDD through the ACL, the Administration on Community Living. The only cut that was made to that under the CR was in the same amount as a public health program that was rolled out under COVID and was intended for a rollback. I've actually been out of the office the last few days, so I have not seen the final confirmation, but our belief at that time was that that was just cutting back that COVID funding and that it would not impact ED Council funding for the remainder of this year. Of course, the budget that's being worked on now, very dynamic. We've not heard anything about a desire to cut DD Council funds. As I think you all know, our work is, I would say it's inherently nonpartisan. You know, disability impacts everyone, and I think that that knowledge is quite well known in this building and hopefully in DC as well.
Thank you so much. We appreciate that. Thank you. No further questions. We'll move on to Commissioner Carlson, DCH, or Department of Community Health.
Thank you.
And Boards of Dentistry and Pharmacy up next, and Composite Board after that. Floor is yours.
All right. Good morning, Mr. Chairman, members of the committee. Thank you for having me. Russell Carlson with the Department of Community Health. Good to be back with you. I know we went over several of these items in the early slides during our amended presentation, and I've still included many of those just for your reference, but out of respect for time, Mr. Chairman, we always like to start off with a slide for your reference take home, if you will, just the status check of things that you passed last year, just to know which things have been approved, some of which require CMS approval, but many of these are in the field, if you will, and I always feel we owe it to you to let you know that we try to, as bills are signed, we try to execute and do what's needed to get those effective. Slides that you've seen before, just to give you a sense of how the department looks as programs. Again, looking at the past fiscal year, or the current one technically, but from past session, the state funds piece, as well as the total funds. And again, out of sensitivity of time, we'll be walking through a lot of these programs, but just give you a sense of the proportionality. This is always a good opportunity, though, to state that we're largely programmatic. We still calculate that out of all our funds, about 97%, sometimes 98% of those are directly to benefits. So we like to think that the funds entrusted to us do get to the Medicaid members and providers participating in the program. As with anything, when you are so benefits driven, you're going to be directly tied to enrollment, with it being so programmatic in nature. So as you guys know, we have been on a bit of a roller coaster ride these past few years with the public health emergency leading into the national redetermination exercise, where everyone had to work through members individually across all 56 states and territories, and I think this trend demonstrates the uptick during public health emergency. Then as redeterminations went down, those roles were getting trued up, if you will, to represent at that time the 2024 status of our members. But then the disaster, Helene, caused some pivots. The DFACS eligibility workers are required by federal law to transition much of their human resources to disaster SNAP, what they call it, to expedite those benefits owed people in the affected areas. So thanks to OPB support, we were able to do some staff augmentation with outside parties to work Medicaid cases to try to keep some steady state while your DFACS workers transition to the disaster responsibilities. And now we're reaching a little bit more of a baseline trend and kind of getting back to where we're in tight correlation with standard population growth. Moving to the 26, just a snapshot of these. Again, we'll walk through these programs. These are some of your state changes, which you should probably be seeing through all presentations. And now we'll get to some of the programs themselves. I like to start out, if we can, 91.4. It's a continuation, and 91.5 of some of the funds granted to us to execute the PACE program. It's a new program benefiting dual eligibles and the elderly population, a very dynamic product that we're all proud of. It's set to be released for procurement hopefully very soon, but that's an intensive process as far as setting up clinical protocols, rates, and actuaries, and that's just a continuation of those services. 91.6 is for additional Katie Beckett caseworkers, which is always in need. Quite a calling there. It's a heavy application process, but there is 75-25 funding for the state, so this would be funded for 3 more caseworkers, in addition to, not represented here, a great deal of automation and investment that is going into the Katie Beckett office for the case management and smart workload capabilities. 91.6, Medicaid provider reimbursement rates. The House asked the department to look at reimbursement rates of Medicaid providers and determine any adjustments to Medicaid reimbursement rates. So that's $1 million line item, and we're looking forward to the exercise. That's a great thing we can always do. But for reference, what the $1 million represents and some kind of context for scope, Commissioner Tanner mentioned the rate studies that you guys were all a part of and helped execute, and a lot of those waiver programs also. Those rate studies, that total actuarial contract ended up being about $2.3 million over a year and a half, 2 years. But that was only for approximately 100 codes that were represented in that exercise. All Medicaid rates, for example, would encompass, with a literal definition, about 8,000 codes. So this is a great exercise, and we'll execute faithfully. But just as far as scope and context, I think in the event that the dollar figure stays the same or increased, we will be obviously in consultation with your budget offices and OPB, letting you know how we potentially might need to prioritize scope to get these things done effectively with the appropriation. So just a little context there. For pharmacy and dentistry, I will kind of yield, if I may, to Mr. Joyner, who will be on the agenda following me, but he'll be able to speak to those. But as you can see, there are several licensing software, new positions, equipment, some very important endeavors, but I do know they follow me on the agenda, so out of respect to their presentation and time, I'll move forward, but happy to answer any questions. 94.2 transfers $100,000 to DPH to support lupus research, data collection, awareness, education. 94.3 was a $200,000 ad for equipment. It's our understanding, based on some of the modeling, that would be intended for Southern Regional and Riverdale, Clayton County, which covers some equipment there that they've been in need of for some time. FQHCs in 94.4, I believe. First of all, eliminates one-time funding for last year, but moving forward, replaces that with some funds intended for several new FQHCs. I know one is intended for the Morgan, Jasper County area. Another one, though, of interest that I believe the House was contemplating in this budget was a school-based FQHC for Thomasville City Schools. So an interesting approach there as we all think through what can be done in the school setting. 94.6 provides $561,500 for the Sickle Cell Foundation, and it's our understanding that potentially, I see Dr. Toomey here, could eventually be in discussions with moving that to DPH, where a base budget already exists for this foundation. We do have a sickle cell pilot project going now, given how Georgia represents almost 25% of the sickle cell population. We've been trying some innovative things there with some pilot programs. 24/7 Telecare and maternal health programs, $500,000 in extra additional funding for these programs. For reference, as we were modeling out and answering requests, I do believe the initial request was around 1.5 million, 1.7 million, so this would represent a portion of that initial request. 94.8, Regional Vascular Center. It's my understanding that there's some contemplation for this in Emmanuel County. 94.9, Behavioral Mental Health Services Stabilization. I'm sure Commissioner Tanner would be supportive. More bed capacity, both general mental and behavioral health beds, but also isolation beds. It's my understanding that this 3.5 million that you see here represents about half of an initial request, so just for context there, how that might be scaled. 9410, Georgia Rural Health Association, $100,000 to advance rural initiatives. And then 9411, Labor and Delivery Grants, $5 million for one-time grants to expand labor delivery services throughout the state. I know we're all hearing about OB shortages in certain areas. I believe, 82 counties, Dr. Toomey, might be without OB services there, so an opportunity for some grant funding to help stabilize that and grow appropriately. 95.3 is still in response as we're continuing to execute last year's Certificate of Need discussions. We're able to utilize fees internally and put them to some additional staffing for the new responsibilities within that division. And also, per the bill from last year, we're expected to renew the state plan as it pertains to health planning every 5 years. We're going to cycle that a couple initiatives each year, so every 5 years you will have a completed, updated state plan. So there's some consultation and technology support for those responsibilities. Let's see, 95.4, last thing, 95.3 does represent, sorry, I'm looking sideways here, some of DBHCD's transfers that Commissioner Tanner and I have been working on, as he alluded to. For reference, those actual programs we'd be transferring to DBHD are DATEPs, narcotic treatment programs, adult mental health, and community living arrangements. Moving quickly into SHBP, 100.1 does look at last year. The General Assembly provided for a dispensing fee within SHBP of $3 to continue. It was one time only, as stated in the caption. So this funding would represent half of what it would take to continue at a $3 pace. 102, 103 represents some adjustments to the revenue side of state health benefit plan as they continue to address differences in how the education community pays into the plan versus state active employees and retirees. And for reference here, out of sensitivity time, I'll move on, but this is a good document that shows the last couple of years in revenues and expenses and how some of your injection of funds have helped stabilize the program, right-size the program. Also, what's not on the charts always needs to be mindful of, we always need to be mindful of, is our OPEB responsibility, large liabilities that help fund our reserves for retirees and to secure the plan for its long-term solvency, something that I know the bond rating community pays close attention to as far as the health of the plan. So there were, as you mentioned, Dr. Watson at the outset, Chairman Watson, we'll briefly go through some of the ads that did appear. Let's see, 97.1 is, as you know, ABD always sees some uptick in growth due to utilization. There's an FMAP change to the state's benefit this past year, so some savings there. 97.3 is the annual update to the nursing home cost report, skilled nursing facility cost report, which this year represents the 2023 cost report. 97.4 is the dual eligible, the Part D clawback that we see each year. 97.5 is CMS approves some newer drugs each year, advanced drugs each year, and it's mandated coverage for some of these spaces, and this represents the state portion of those treatments. They range from treatments for sickle cell, hemophilia, muscular dystrophy, and the like. 96, 97, and 98 deal with the provider fees and just how revenues and the fee responsibilities measured up this year. So some truing up there. 97.9 is increased reimbursement for EMS. Basically, they're proposing a changed methodology, whereas now the mileage on the reimbursement begins at 10 miles. I think this proposal was based on what it would look like to begin reimbursement upon pickup, so mile 0 versus what is now policy of mile 10. 97.10, a rate increase for neonatologists and maternal fetal medicine specialists. This analysis was requested of us. At its current state here, the current rate would represent probably about an 8% increase. 97.11, increased reimbursement for CIS speech therapy, a particular code that we believe represents about a 5% increase. 97.12 is an increase to general EMS reimbursement rates that we see as a 5% increase. 97.13, increase to ABA reimbursement rates. There's been a lot of attention to that, incentivizing more providers to get in that space. And we've seen, the incentive has been paying off. We're seeing a lot of increased utilization in this space. So the incentive that you laid out there for providers seem to be taking hold. But this would represent what we see as probably about a 3.5% increase. Nursing home vent rates, we believe this number represents about a 5% increase. 97.5 proposes some increases for air ambulance reimbursement and some changes to methodology. 97.16 represents a rate increase for particular primary codes. We see this for these codes to represent about a 4.3% increase. 97.17, increased dental code reimbursement rates. We see that as approximately a 5% increase there. 97.18 pertains to DME, durable metal equipment increases, which we see this number to represent a 2% increase. And much of this, Mr. Chairman, members of the committee, just kind of represents those same programs but spread across the low-income Medicaid portion of the program, and as does several of the Peach Care changes. There is one change for the continuous eligibility process implemented by the federal government in the 2023 Appropriations Act, I believe it was. And so as for changes, Mr. Chairman, members of the committee, that concludes our presentation. I'm happy to answer any questions.
So Noraki, look like teeing up for a question there.
Thank you, Mr. Chair. Thank you, Commissioner.
Yes, ma'am.
In the face of what's going on in Washington, what sort of stance does that put us in with the high needs that we have and the pilots that we need to expand, and all of what your department is charged with delivering on? What's the posture?
Yes, ma'am. Obviously, that's as spot on a question as you could ask for. There is a great deal of uncertainty, and it really is changing. Real-time conversations being had. We did have some exchanges with several leaders with the committees of jurisdiction, Energy and Commerce on the House side, Chairman Buddy Carter, his office, and then obviously the Senate Finance Committee has jurisdiction there. They have said that Medicare's off the table, and they've said that Medicaid benefits are off the table, and that's all public from the president and others. So then you're left kind of understanding what beyond that is out there that could leave potential funding revenue streams, whether that's provider fee models or the directed payment program models. One thing we are concerned about is our State Office of Rural Health in Cordele largely administers a lot of federal grants. Thus far, our operations are staying strong, but we know, there's no guarantees there. So I would think some of the payment models are under review right now and being discussed, if benefits themselves or not. So we're just trying to stay in communication, really paint the picture for how Georgia utilizes these programs and how we use them for urban centers, but also help, support DISH and the rural networks also. So
Big question marks.
nobody's crystal ball is batting 1,000 right now, so we'll see how that goes. But I think we're, at the very least, I would submit to the committee, we're well positioned to at least have a good flow of information. There's been a lot of dialogue, so I'd like to say whatever happens, we would at least be informed and have some appreciation for what's going on before it happens. But
we appreciate that. We appreciate your comments about real time, and I mean, I know that's accurate because when I've gotten calls from DCH at times, they're sitting in the office in DC. So
Yes.
that's I appreciate that.
Yes, sir.
The pace you said that that program is close.
It is, and so many, to include yourself, sir, have been very patient with this process. It was new to the state, so there was a lot of back and forth with us and CMS on getting all the clinical and reimbursement guidelines appropriate. DOAS has been great to work with, and we hope that should be released too, and soon. And I do think, Joe, correct me if I'm wrong, but I do think when it is released, we're going to be able to expand our targeted pilots, our areas quicker.
That's great.
So.
Any other questions? No. Thank you. Boards of Dentistry and Pharmacy. Thank you, Commissioner Carlson. And Composite Board's up next, and Georgia Board of Healthcare Workforce.
Good morning, Mr. Chairman and members of the committee. My name is Clint Joyner. I'm the Executive Director for the Georgia State Board of Pharmacy and the Georgia Board of Dentistry. With me this morning are Dr. Michael Knight, the President of the Georgia Board of Dentistry, and Mr. Stacy Altman, who is the Deputy Director for the Board of Dentistry. Just briefly, I want to touch on the amended this committee funded, with the House and the Governor's Office funded our transition to the Evoke licensing software. And I mention this because it's relevant to the first FY26 appropriation I want to discuss, which is providing funding to both boards to cover the difference between the cost of our subscription to our current My License Office software and the cost of the subscription to Evoke. I also want to point out before we move further that the boards of dentistry and pharmacy are net revenue generators for the state. Their budgets together average about $2 million, and they bring in about $7 million per year, so net about $5 million. In short, the board's revenue generation far exceeds its footprint. I found this description at the bottom of the track sheet we're all working off of on page 14, and I include it because it highlights well the key responsibilities of the Board of Dentistry. And unfortunately, I have to report that the board is at severe risk of failing to meet these last responsibilities. And the reason for that follows here. The board currently has, at present, the board has a large backlog of cases and is receiving more cases per year than it can process. Compounding this issue is, over the last 10 years, the board has seen a year-to-year increase in the number of complaints received of almost 17% per year. And that is, the board cannot contend with what it currently receives, which was 806 cases last year, and we're expecting to receive about 930 next year. And for the public, this is the piece they really feel, is that 18 to 24 month case resolution time, which you can compare that to the Board of Pharmacy is an 80-day resolution time. And part of the reason for that is the entire investigative capacity of the Board of Pharmacy, or of the Board of Dentistry, Stacy, is this gentleman right here, Mr. Stacy Altman. We have one investigator for the entire state, and he handles all aspects of the investigative process. And the task laid out for him is simply too much for any one person. And so we requested additional investigative personnel to reduce investigator caseload, decrease case resolution times, enable multiple larger scale investigations at one time, which is currently, this piece here is currently something the board is almost unable to do. We have to tackle those things at one at a time as they arise. And we've also want to add non-certified personnel to allow our post-certified investigative personnel to focus on investigative tasks and relieve their administrative burden. Compared to other similar licensing boards, you can see that the Board of Dentistry has a caseload that is 2 to 5 times the caseload of similar boards, and the reason the Georgia Drugs and Narcotics Agency has been included here is that they are the investigative arm for the State Board of Pharmacy. And so they perform the same function for pharmacy as the investigative unit does for the Board of Dentistry. Which brings us to the appropriations recommendations from the House, and that is to increase funds for 4 new investigative positions. We also requested law enforcement equipment, which was items like firearms, ballistic vests, handcuffs, vehicles, gun holsters, etc., for our post-certified employees, and also funding for training and investigative software and services, which I respectfully request that this committee give favorable treatment to this recommendation. Additionally, the board is at significant risk of losing its licensing personnel. Our licensing personnel are subject matter experts in licensing, and this is an issue for both dentistry and pharmacy. Last year, we lost one tech, almost lost a second, but we were able to match her departing salary. We also lost our executive director and board secretary last year to another licensing board because our salaries, we simply were not able to be competitive in that regard. And those losses represent an immense amount of institutional knowledge lost by the board. And so we also have requested retention raises or funding for retention raises for licensing personnel, and I would request that this committee request favorable treatment from this committee on this recommendation as well. Which brings me to the Board of Pharmacy. Are there any questions for dentistry? Pharmacy is on the exact opposite, has the exact opposite problem. That because their investigations are taken care of entirely by Georgia Drugs and Narcotics, there's no investigative issues with pharmacy, but pharmacy's had 4 licensing techs primarily since it's separated from the Secretary of State's office. And in that time, we've added non-resident pharmacies, durable medical equipment, and low THC pharmacies. And DMEs are of particular note because this is a license type which tends to have a lot of ownership changes and a lot of location changes. It just seems to be endemic to that industry. And so this license type in particular requires a lot of subsequent touches from staff. And so in addition to being a new license type, it also added several new types of continuing occupation to our licensing technicians. And at present, the board is meeting its advertised licensure times, but it's not doing it sustainably. Our staff are, you could give me an hour and I couldn't say enough incredible things about my staff. They work to the task, not to the clock, and they're doing nights and weekends regularly just to make it work. And the concern obviously is burnout. And so we requested additional licensing analysts, or additional licensing and customer service personnel. And this is a chart. We're targeting a 20% reduction in analyst caseload to allow both to obviously reduce their load and need to work additional hours, but also to allow for some future proofing so that we can absorb new license types as they may come. And so ideally, we would like to get between 6,000 and 5,000 applications per year. Additionally, we requested an additional customer service representative. The most common complaint we receive in the board office is that no one can reach the board. And during licensing, or during renewal for pharmacists last year, we were missing between 1,000 and 1,500 phone calls a week. And now we're just now going into pharmacy technician renewals, and we have a renewal period about every 6 months. And so we're requesting an additional CSR to allow us to better man those phones. And so these were the House recommendations for pharmacy, and that was to fund 3 new positions and increase funds for the retention of licensing personnel, which is on the same rationale as I discussed for the Board of Dentistry. And that actually concludes my presentation. Are there any questions?
Questions from the committee? So I'd like to meet with you offline. And,
Sure.
As in like later today or tomorrow.
Okay.
Thank you. All righty. Already at the podium.
Yes,
Thank
sir.
you. Appreciate it.
You said make it quick. We're going to try to make it quick.
You're right. Thank you. Floor is yours, Mr. Jones.
Okay, thank you. I'm going to go through some of these, so I'm going to skip some of them as we go,
Absolutely.
but I'll try to make sure we stay on target. Appreciate everything, the support that y'all give us. You know, we're in the rebuilding stage, so this will show kind of where we're at, what we need to do. So I want to start with some stats, some statistics. So we licensed 66,135 professionals, all through these license types, physicians being the most. And I want to show you that the total licensing increase of 1,068 so far from fiscal year 24 to 25. So it shows we have an increase in licensing that's coming in. Also, the APRN protocol agreements. It's not a license, that's just a protocol that we review and approve. That's over 21,000 that our staff has done since July of 2024. So that's a growing number that's coming at us. Compliance investigation totals. As you see down at the number of compliance cases reviewed, the medical directors, that's supposed to be 60, so it's 60. Peer reviewers, 52. In fiscal year 25, we've increased that, so we have 60 reviewing medical directors, and in peer review, 146. So in medical directors' hands are 257 complaints to review. So that number has increased drastically, so we can meet the needs of the state. So I'm going to go ahead and skip through this and get us through to 2026. Those other slides are just updates that you can look through to see what we've done with the funding that you provided last year. But I didn't want to go through all that. So this is the actual funding request for this year on House Bill 68. As you can see, we're eliminating one-time funds of over, I think it's 591,715. That's being eliminated from the budget. What we're doing is requesting that to stay so that it can meet our needs with our personnel. We're asking for 4 compliance inspectors within this House bill. They provided us 2, but we're still asking for the 4 to meet our needs on the compliance cases that I talked about earlier in those stats. We are also looking at line item 107.5. That's going to be the 2 compliance inspectors that are on this bill, but we're requesting the 4. 107.6, 2 licensing techs. That's to keep up with the stats that I showed you with the licensing and the protocols that we have. 107.7, that's the increase in, 107.4 is at the top. That's going to be a paralegal that we need. The board has a lot of orders, open records, rules and laws to review, board minutes, legal correspondence, compliance tracking that right now our deputy executive director is doing. She is overwhelmed and overworked, so we're trying to get her some help through a paralegal that can help her through that process and also help be more efficient and timely with those. So that's our personnel request. So there are 2 new programs that we're going to be a pass-through for that I believe has been trying to get funded through the years. One will be the professional health program, the Georgia PHP. And if you look at the slides, the Georgia PHP, there is a law in place that we can contract with an agency to do this. So we're asking for $750,000 in funding to be able to maintain this program. Right now, it's not funded by the state at all. They have the participant fees that pay that. So the medical professionals that have to go into this program actually pay that fee, and that is kind of goes more towards the staffing and the operations. So with this $750,000, it will help with that operations of that program to hopefully get more people in it, so they can actually go through and do a little public outreach and let folks know that it's there and available for these medical professionals. So that is there for your perusing. The next program is called Safe Haven. as kind of a precursor to PHP. So Safe Haven offers mental health wellness support for healthcare professionals. We know how much they work, how hard they work, and how overworked they may be. So the stresses, it kind of helps with that. This will actually, $750,000 will actually fund all the enrollment fees and things that the cost for these professionals. And it's estimated that there should be somewhere around 2,500 participants in that, and it'll fund those 2,500 participants in rural areas that can help with burnout and help with mental wellness in this program. So that's our request. Try to make it quick for that, but in my presentation there is additional information if you don't mind reviewing that. Kind of gives you more information on what we're doing.
Seems all right.
Thank you for your leadership and participation with us today. And the Physicians Health Program, that those are the House ads. And I noticed in your notes that we're the only state in the country that hasn't been putting money in.
From our research, we're the only one that doesn't have funding from the state for those programs. Yes, ma'am.
So this would take us down the right road.
Yes, ma'am.
Thank you.
Any other questions? Thank you, Ms. Jones.
All right,
Appreciate
thank you.
that.
Thank
you.
y'all.
Good morning.
Mr. Basine. Good morning.
Good morning. I'm Chet Basine. I'm the Executive Director for the Georgia Board of Healthcare Workforce. I thank you for having me speak this morning. I will be brief, being aware of the schedule. So with that, what I will do is I will go into our first slide and I'll speak to the governor's recommendations. And then I've also listed the House adjustments to the right of that, if you want to see in any of those line items any of the changes. So really in administration, we are, there's really just one statewide adjustment for DOS. It's listed there for $6,149. Besides that, that was all that was there. Within GME is the next program. This is the second of 6 programs that we have. Graduate medical education. There are a series of transactions going on in here. First, you'll see the governor has added funds for 75 new residency slots, and that's in primary care. Those are scattered at a variety of hospitals all over the state, geographically speaking, and that's the tune of $1.508 million. Then we do have some reductions. One is for the FMAP, that is for $411,070 on line item 102.2. There's also a reduction of $50,000. That was a one-time startup funds for pediatric rural training from last year. And then on the same lines, a reduction of $750,000 on line item 102.4 for rural OB-GYN expansion that was there from last year. All in all, that brings the GME segment of the budget to a program net of $297,559 per the governor's recommendations. I'm going to carry on with the next program within our budget. That's the Physicians for Rural Areas. This is all healthcare licensures. We call it the physicians, hopefully for not too much longer, Physicians for Rural Areas, but this is physicians, dentists, APRNs, PAs, and this year, a full assortment of behavioral health care practitioners. So within this program, the $250,000 that you see on line 103.1, that's really just a reclass. That's not net new funds. You're going to see that in a minute coming out of a different portion of our budget. We just did that to get all the loan repayment dollars under one roof for accounting purposes. And then 103.2 is a no dollar amount, but to what I was talking about a moment ago about the naming nomenclature, we're asking to go to the Georgia Board of Healthcare Workforce Healthcare Practitioner Loan Repayment Program. So that'll take away the name that we've used for a while as we broaden our wings and focus on physicians, but other licensees within the healthcare space. It's very broad and diverse. With that, I'm going to move on to the next one. In our programs. That's the Mercer School of Medicine. The first item is 104.1. You'll see a $565,204 increase. That's part of a preset plan from 7 years for their Columbus campus. So this is year 6. And then the next two items, both 104.2 and 104.3, are reductions. 104.2 being a reduction of $75,000. It was one-time matching funds. And then the same thing with 104.3, the $500,000 one-time matching funds for a scholarship program that they operated. The next one is the Morehouse School of Medicine. There were no changes in there, so I'll just skip over that one. And then last but not least, you'll see the undergraduate medical education program. This is that $250,000 a few moments ago I was talking about within the loan repayment program that we reclassed into the currently called the Physicians for Rural Area program. This is where the $250,000 is coming out of. So again, it's a net neutral monetarily speaking. And that brings me to the summary. You'll see the original budget, the governor's recs, and then the House recommendation next to it. So in the spirit of time, I did hit the turbo button for you. But if there's any questions, Mr. Chairman, or anyone, I'd be glad to entertain them.
Yeah, 102.1, the 75 residency slots, and are these pre-approved new programs, Medicare drawdown, Medicaid match? Where can you help define those for us?
Yes, excellent question. These are either new and or expansion slots throughout the state in primary care. And the 75 reflected in the governor's budget, what we do at the agency is usually around the fall time, we put out a message to all the contacts that we have and at the hospitals, and we do engage the GR and the GR team at these institutions as well and say, hey, can you just let us know what you got planned? We keep a spreadsheet going at the specialty and location level, and then we submit that into the governor's office as part of the budget development process.
102.5. Talk to me about that. Where is that? And
On a 2.5, increased funds for 4 child and adolescent psychiatry fellowships and 2 gastroenterology fellowships. The House ad of $319,654. Is that what you're referring to, Mr. Chairman?
yes.
To my knowledge, that is for those areas of clinical medicine for the Morehouse School of Medicine is what I'm the understanding of.
Is that in conjunction with Phoebe Putney or Grady or new programs or the alliance that they're having with or collaboration they're having with Albany?
I'm not sure to the extent that it's involved with Putney, just because that's a new development. And my presumption, and again, I'm not 100% sure with Grady, knowing that all the Morehouse physicians in training do go there, my presumption is they would go there, but to what extent the alignment is there, I don't want to misspeak.
And does Morehouse hold the residency spots, or is the hospital, or do we know the details on that?
Morehouse holds them through ACGME.
Okay, and that is a relationship they have with Grady or
Yes.
Albany, or
Morehouse, to my knowledge, has a great working relationship with Grady, where their residents and fellows do go there and get their training that they need.
okay. All right, might need some follow-up on that. Thank you.
Sure.
Any other questions from the committee?
I was just going to say that the Morehouse is now expanded. Nursing program is now, going into the Phoebe Putney space, and is already in Columbus. So I know that they're stretching, and also here in Fulton County to be a part of any workforce. If we can get up another hospital to replace the WellStar exit from our county.
And Emory's doing that too with the overload that they have, and that was the section of the budget related to mental
Thank you,
health.
Mr. Chair.
Yeah, thank you. I appreciate that. Department of Human Services. Thank you, Mr. Pristine.
Thank you.
And up next is Council on Aging, Voc Rehab, Public Health, and Veterans. We got 36 minutes for everybody.
Good morning. If you want to go ahead and go to the next slide. Let's see. All right, I'll go ahead and drive. All right. Okay, so these are the governor's recommendations for fiscal year 2026 statewide adjustments, workload adjustments, total adjustments, and let's see. Wait a second. Not sure why it says Senate recommendations, but at any rate. Okay. Let me run through statewide adjustments. So recommended reductions for statewide adjustments for FY26, total $627,409. Those are reductions in insurance premiums for programs that DOAS runs. There are reductions in state funds just to reflect a higher drawdown in FMAP. That's pretty standard for our agency. There are two increases related to TeamWorks. That's the statewide personnel management and financial system. There's one increase under a program budget related to the teacher's retirement system. So that covers that $627,409, which, let me go back and see if it's right there. Here we go. And then for program-specific adjustments in fiscal year 2026, I'll get you to go to page 35 of your tracking sheet, line 195.2. That's program budget, child abuse and neglect prevention. There's a reduction of $93,233. That's just to reflect lower collections of marriage and divorce filing fees in FY24. That's the State Children's Trust Fund. That's something that's statutorily earmarked for this program budget for my agency. It's long been in place. On the same page, line 195.3, the House added $150,000 to expand services for an existing contract that we've had. That's for the PACE Center for Girls. The base contract that we have for that contractor is $650,000, so that's an additional $150,000 on top of it. And we're still gathering some details for the scope of services that they'd like for that PACE Center to add. Next page, under child support services, there's an increase recommended by the governor, just shy of $61,000. That's line 196.2. That is to enhance our Division of Child Support Services' ability to better match using the child support lien network. That's just a better tool for ensuring financial support for children. On line 196.3, the House added $191,428 for the DeKalb County District Attorney's Child Support Enforcement Unit to cover what they say is a projected shortfall. That is to annualize funding that was recently approved in the amended fiscal year 2025 budget. On page 37, line 197.3, under child welfare services, the governor included $1.7 million in state funds. That is to plug a hole based on a reinterpretation of the use of a federal fund source that the outgoing Biden administration provided to us. They said that a fund source that we used for a long time contract for Georgia CASA, we can no longer use, so the governor recommended that we plug that hole with state funds. So you'll see that's why that amount is included here in the big budget. On line 197.4, the governor recommended a reduction of $1.5 million for a wraparound services pilot. That was for the vendor Unite Us. Originally, there were state funds included to match what we thought would be match federal funds that were eligible for this pilot. It was a closed loop referral system to provide care coordination that we rolled out for juvenile courts for 58 counties statewide. The purpose was to allow for enhanced care coordination for the child in need of services case type. When the juvenile code was rewritten several years ago and that new case type was created, there was no single agency designated to run point. It was a case type that was designed to help keep kids unnecessarily out of the foster care system and out of the DJJ system, to help families navigate services if they could. But again, no specific state agency was designated to run point, so we were hoping to work with these different juvenile courts and provide this closed loop referral system to connect families with services. The House disagreed with the governor's reduction, and so that's why they eliminated the recommended reduction. The last item for that program budget is on line 197.5. The House included $125,000 to expand the heavy equipment operator certification program for high-risk youth, specifically for what we believe is a longtime DFACS contractor, Broken Shackle Ranch, located in Washington County. Their base contract is $300,000, so this additional funds would be on top of that amount. On page 42, line 201.2, under program budget Elder Community Living Services, you'll see a transfer of $225,000 to the Department of Public Health. That's for brain health awareness. They have existing capacity in this space. That funding will be better utilized because that is their wheelhouse as opposed to our agency. And again, this annualizes a transfer that already occurred in the amended fiscal year 2025 budget. On line 201.3, the House included a little over $1 million to expand non-Medicaid home and community-based services for seniors across the state. That additional funding would allow us to serve an additional 400 seniors that are currently waiting for services. But again, we are going to get some additional details on that, and it was not originally recommended by the governor's office. On page 44, under program budget federal eligibility benefit services, there's a yes caption, line 203.4, to utilize existing funds to improve how we process more complex Medicaid eligibility cases. On line 203.5, the House included just shy of $6 million to annualize a $3,000 salary increase for eligibility caseworkers. That increase would go to over 2,600 caseworkers who assist Georgians in applying for and receiving economic assistance, including program assistance like SNAP and Medicaid. On line 203.6, the House included a directive for the department to prepare and submit a plan to address backlogged eligibility determinations. That plan would go to the chairs of both appropriations committees and OPB, which we're happy to do. In out-of-home care, page 45, line 204.2, the House included $19,293,420 for increased utilization and costs. This budget specifically provides temporary living arrangements for children who cannot safely remain in their homes due to abuse, neglect, or other serious family issues. Essentially, this is where we fund foster care. The funds in this program budget help us place children in safe, stable environments while we either try to reunify them with their families or find a permanent home through adoption or guardianship. I've talked about this in prior hearings, so I won't get too much into detail here for the sake of time, but what we're seeing is more complex children are entering care, and that means that their cost of care is dramatically more expensive, and every child welfare agency across the nation is seeing this. So for state fiscal year 2026, we are projecting an additional $44,470,858 in state funds needed to meet projected expenditures. So the $19 million included by the House is obviously a huge investment, and we would ask humbly if there's any additional funding that the Senate could provide to make this program whole. We would be deeply appreciative. The House also included the following line items: line 204.3, $400,000 for essential clothing and supplies for foster youth; line 204.4, $500,000 to place foster youth closer to their biological families. Again, this is another one where we have an existing contract with this particular provider. We understand it to be families for families. Line 204.5, a little over $6 million for a 2% provider rate increase. we work hand in hand with the Provider Association, Together Georgia. I know they've been working really hard to get a provider rate increase. Some of these, one-off requests for specific providers, if the Senate does want to do a provider rate increase, what we would ask, and I know they will ask, is that those one-offs go into an overall rate increase instead of, looking for those one-offs. I think that makes it fair and equitable for all of our providers. Line 204.6, $371,500 for community action teams to deter child welfare involvement. What we understand is that is, again, some additional funding to go to an existing provider, youth villages. Line 204.7, $325,000 to support youth aging out of foster care. Additional funding to go to an existing provider, youth villages. So on several of these items, we're still gathering some information, which we'll get to the Senate Budget Office. I'm trying to hurry, so bear with me. Next page, under out-of-school care services, line 205.1, the House has recommended reducing the program's $2 million in state funds and instead recognizing $10 million in the Department of Education Student Support Services for out-of-school care grants. We know that this will impact an existing United Way contract for learning loss that was appropriated in recent years. Expected impact is roughly would go to learning loss, programs for 2,900 kids across 63 grant providers for last state fiscal year. From what we understand, I think that United Way and these grant partners could work with the DOE. Again, still gathering some details on that front. Page 47, line 207.2, under residential child care licensing, there's a yes caption to utilize existing funds to hire a dedicated employee to implement 2 new license types. I talked about this in the amended budget, so I won't belabor the point, but our agency has implemented 2 new license types due to changes in federal and state law. What it means is that there are now some additional step-down facility types with specialized care. It means in the future we're going to be able to draw down federal funds for children in foster care or those at risk of entering foster care, and that will eventually displace what we're using for state funds. So that will be a significant savings to the state soon. Not yet, but soon. And we continue to make investments as we can to have those savings to the state. Let's see. Sorry, I'm not keeping up with my slides because I'm trying to hurry. Let's see. Typically, I wouldn't touch administratively attached agencies, but I will say, since I'm chair of the Safe Harbor for Sexually Exploited Children Fund Commission, lastly, page 54, line 217.1, there is a reduction of $120,110. That's just to reflect reduced fiscal year 24 collections of financial penalties for sex trafficking and sexual offenses from adult entertainment establishment assessment. So those reduced collections are somewhat unexpected. It means that commission will certainly see an impact in making grants available to providers in that space, but we'll proceed accordingly. So at the end here, there's contact information for my fiscal affairs leaders, and I'm happy to answer any questions. Also prepared to answer any questions about the 1% and other savings we're trying to capture.
Yeah, if you can just give us some follow-up on that, either later today or tomorrow. Update on Kenny A. Case.
Yes. So Kenny A is a class action litigation that the state has been involved with for many years. The original lawsuit was filed, I believe, in 2002. It still involves DeKalb and Fulton counties and allegations of violations of federal law involving children in foster care. The state entered into a consent decree with the plaintiffs in 2005. Since that time, the state's made significant strides in making changes to the system. So we filed a motion to exit this litigation with Chief Justice Harold Melton as our counsel last September. There are no more ongoing violations of the law, so we think we're positioned well to get out of it. Since 2005, the state spent $43 million defending itself in this matter. 17 million alone has gone to legal fees, which means it's not gone to children. So we're pretty optimistic about our odds here, and it means that, again, that will be significant savings that we'll capture.
Thank you for the update. Appreciate that. All right. Next up, Council on Aging, and then Voc Rehab, then Public Health and Veterans. We're getting close on time here. So we got the room till 9. It's 8:40. So that's, let's do the math. 20 minutes, we got 4 people. It's 5 minutes apiece. Can you do it in less?
I can do it in less, sir.
Great.
Thank you so much, Chairman and Committee. I'm Deborah Stokes with the Georgia Council on Aging, and I represent the Coalition of Advocates for Georgia's Elderly. We are an attached agency to DHS, and we advocate on behalf of the 1.5 million seniors within our state. That population is growing rapidly, and their needs are also growing rapidly. To be brief, we have 2 sections of requests here. The first one is for home and community-based services. Everybody in here is familiar with that term, HCBS, because it allows the state to save money by keeping elders in their home as long as they can, so that they're not institutionalized. I can give you the numbers that show the difference between the home and community-based services funding to keep people at home and the amount of money it costs to keep a person in a nursing home facility. But I won't go through that. I do have a presentation, but it's going to be abruptly done away with. So I'll ask, this year we asked for $2.5 million for home and community-based services, and that is on, we asked for 2.5, and on lines 201.3, funding for home and community-based services, the House gave us a little over $1 million. And our ask from COAGE was 2.5, and we are asking the Senate to please at least match the House number or provide us with an additional $1 million for that funding, so that we can take people who are eligible for those services off the wait lists. We are not able to provide them because the money is not there, but they are eligible, and we want to give them the services that they are eligible for. So that is our perennial ask. In the past, we've asked for 10 million, and we've gotten as much as 5.4. And that number is so high because there are always people on the Tier 1 wait list who need these services. And if we don't have the funding, we can't provide them. My second ask is for the council staff itself. We are a staff of 3. And as I said earlier, we serve 1.5 million seniors over 65 in our state. That number is growing. We've embarked upon an effort to consolidate and coordinate all of the services within the agencies, all of the agencies of the state that touch on the senior population. We've got a lot of siloed information out there, and we need to try to pull it together. So as a staff of 3, that's very challenging. So I'm asking for funding for an additional staff person. The scope of work of the council hasn't been evaluated in more than a decade. So having 3 people attempt to manage the needs and represent and advocate on behalf of 1.5 million people is kind of difficult. So that's my ask. We had the Council on Aging and the Coalition of Advocates for Georgia's Elderly had 3 budget requests this year of our 5 priorities that our members sent us here to advocate for. One of them is for home and community-based services. One of them is for funding for a multidisciplinary teams coordinator to handle elder abuse and exploitation within the existing judicial circuits that have multidisciplinary teams. That's an ask of about just under $200,000. We also asked for funding within DCH to look into whether or not the state would benefit from offering Medicaid in assisted living facilities. So those are COAGE priorities that sort of show up in other agencies, but they're things that the stakeholders and citizens across the state are interested in seeing happen within our legislature. I'll be happy to take any questions.
Thank you so much. We appreciate that. No questions? Georgia?
Is there a handout?
It should be in your packet.
And
You're welcome.
Georgia
Thank you.
Vocational Rehab Agency and DPH and Veteran Services.
I'll be reading from the track sheet. We don't have a presentation out of brevity. My name is Chris Wells, Executive Director for Georgia Vocational Rehabilitation Agency. Again, we'll make it fairly quick. We have 3 requests from the House recommendations. If you turn your track sheet on page 51, you'll see 213.998, a request to transfer $576,042 from our vocational rehabilitation program, which is the same line item, corresponding line item is 216,998. Basically, we've captured some efficiencies throughout the agency. Leveraging technology, we've added over 150 individuals over the last couple of years, and so those 6 positions is a little bit more of our administrative efforts in the field. But as we consolidate resources and look to capture those opportunities for work agency-wide, we wanted to make sure we were aligned and we could streamline our operations by moving those positions into admin. Our last request, or the request that shows up, is on page 53. You'll see 216.3. That's $125,000. We have an agreement with the Friends of Disabled Adults and Children for approximately $450,000. This adds to that particular agreement, which allows us to provide durable medical equipment for individuals that are seeking opportunities to come into the agency or independent living. That concludes our presentation for GVRA.
Great, thank you. Appreciate that. Any questions? So basically, the transfers, but the real ask is 216.3 then. Gotcha.
Yes.
Okay. Thank you so much.
All right, thank you.
Anywhere you would like.
Fast and focused, and I don't have to worry about the mic.
That's great. W3. If you just pull that mic close to you,
Yep.
right there,
Okay.
that'd be great.
I think we can really skip through this really quickly and highlight some of the things that were changes.
Maybe a little closer.
It were changes and also that may be of special interest. I won't go over the administrative changes that, like the other agencies have, very, all the same. And there's a number of program and budget items that the governor had recommended and the House had also recommended that you've heard me talk about before, and I think I can skip through those pretty easily. Obviously, I'm available to answer any questions anytime. Just let me know. Let's go to the House changes, because I think that might be most important. And you'll see I put a red line around a little box to highlight a couple of ads. One was to increase funding for public health to work with the study committee to look at EMS transport from rural areas. And this actually is something that we had been talking about. And so there is a great deal of need to be looking at this. The one thing that to bear in mind is that in the area of maternal transport, there's a tremendous concern that if you don't have the assets for an EMS to transport a mother during pregnancy if she's having a difficult delivery, and it may leave a rural county. This again is a rural issue, not a metro issue. A rural county without an ambulance service for other health conditions that may arise while that transport is occurring. And so I think this is something that can be considered. If you will think about moving the end date beyond September 1st, even to the end of this year, because that's very fast in just a few months to come up with some real guidelines for that. But again, your decision. I wanted to highlight the GCC elimination, especially because Senator Kirkpatrick, I think, was surprised that it was on the last budget that we talked about. That was a pass-through. We did not control those funding. It went to Grady for monitoring EMS ambulance services. The recommendation was to eliminate that totally. Because this was a pass-through, Grady itself will be making those decisions how that will happen, and they say that can be ended by the end of April. But in more detail on how that will occur, it has to come from Grady, and we can help facilitate that. Moving on to the next slide, newborn screening, there's Krabbe disease that will become part of our permanent portfolio. And then the House added Duchenne as a pilot. But I want to quickly move on to the next items because I think there's a tremendous interest and potential in what I'm going to talk about with you. As Commissioner Carlson was saying, we have many, many rural counties. In fact, 107 to be exact, without labor and delivery, without birthing facilities. We have, in the last decade, more than 15 hospitals have closed their L&D. And so we recognize that there's a tremendous need to improve maternal and child health services. Several years ago, I first came to you talking about the potential for home visiting. I didn't come up with that myself. That whole idea for home visiting was developed in partnership with the other health agencies. We talked about how to do that. I remember sitting at a meeting and very pointedly was asked, why do you always do pilots, Dr. Toomey? Why don't you do something that actually is sustainable? And I want to say to you, this is not only sustainable in the 2 years that it has been in place, it has saved lives already of mothers and babies. And I'll be happy to share with you some of the narratives we have about that, including from Chairman Watson, from a pediatrician at your hospital, who credited this program for identifying, when visiting a high-risk mom, an infant that was about to expire, and not recognized by the young teen mom and her family. So these are the sorts of things that, with that that effort put together by multiple agencies to develop a plan to address moms before pregnancy and to provide them not only with medical care, so the home visitors, sometimes nurses, it could be community health workers who are trained to do these assessments of the mothers medically, not just blood pressure, but other diabetes checks, other medical assessment, but also mental health checks, also social checks. I mean, what are some of the situations in the household that may be a risk issue for the mother and the baby? What are the other children in the house who may need access to other services, including SNAP and WIC? And we can help facilitate that transport and transfer and enrollment, but also if there needs to be some sort of transport to a more intensive medical checkup, can actually arrange those transports. So it isn't giving a mother, here's a number to call or here's a website. Our workers actually help to do that. And it has made a difference. It is a program unlike any other in the country. We have developed this model. We are assessing it to be able to have it reflected even in the federal portfolio of home visiting programs. And I think my dream, my impossible dream, is, in my 2 minutes left, is to have Commissioner Carlson be able to fund it with Medicaid funds, because we have worked out this, we're working on, we're working on that. So anyways, and the idea is for it to be sustainable. The governor, we had 50 counties last year. Many of you, particularly Senator Watson, have a number of sites, new sites coming in with what the governor has recommended, moving up to 75 counties. And actually, I know we actually, Senator Hickman has a particular issue in literacy. We even have built in some components for literacy as we're doing those home visits postpartum. So, you know, this is a really good program. It's a Georgia program. It's paid dividends, and I'll be happy to show you those data, because it's not a pilot anymore. It's a real program, and and it works. The other two issues is on the perinatal centers. You know, perinatal centers have been in place really since I first became engaged with DPH. Even before that, in the 90s, they were strengthened, but there's been very little improvements in the perinatal system. But in the meantime, if you see this map, much of the perinatal capacity, as we talked about, is concentrated in metro Atlanta, with very little in rural areas. And if you have a mother who's getting care in South Georgia, she may have to travel hours to get to a specialist in fetal maternal medicine. That's the specialist who takes care of the highest risk mothers who may have diabetes, may have heart disease. And certainly heart disease is one of the leading causes of maternal mortality, but also bad outcomes for the mother and the baby because of her health. And what we have proposed to do, and again, with our partnership with DCH, is to take and redirect funds to the perinatal centers. And with that, be able to draw down additional federal Medicaid dollars to place to strengthen the perinatal fetal maternal capacities at these 5 rural perinatal centers. And so you can see where they are in Savannah, in Augusta, in Albany, in Columbus, and Macon as well. And then with that, have workers from that perinatal center go to health departments around rural Georgia. We have existing telehealth capacity within our health departments. So mothers will be able to come to our health departments with those perinatal workers there and do the kind of tests that would otherwise require them to travel all the way to Augusta, all the way to Macon, all the way to Savannah. And it's what I love about it is providing that care, providing it at home so they don't have to travel or leave their other family members, but also it's using the equipment that you all have given us and that capacity that we have in an extraordinarily effective way, and building on the home visiting process as well, because in many ways this is how we've identified the women who need this. I love to, as you can tell, I love to talk about this, and I'll do it again if you need me to. And the last thing is to, again, because we haven't done a lot of strengthening of the perinatal systems, to strengthen the system further by identifying what the levels of care are. The highest level of care are at these perinatal centers, but also there's birthing hospitals who don't have that capacity. And let's face it, there are hospitals that end up doing deliveries by default because there's not transport to another facility. And so this will allow some workers, in conjunction with the perinatal centers, to go and do an assessment like JACO, but in conjunction with JACO, ACOG, and the Academy of Pediatrics, to look at the quality of services, ensure they are meeting the needs that we have defined, not just for National Joint Commission, but for our perinatal system working within Georgia that has the rural challenges that we have, as well as the other health challenges. And so I present that as a package, which I think is really going to lead to a stronger and strengthening of that perinatal system, the hub and spoke model that can provide better care to mothers and babies throughout Georgia. And I've run out of time, but there are some capital projects as well for our three district offices. We have 3 state district offices and our Decatur lab, and those were put in by the governor and approved by the House. And
Thanks
that's all.
so much. Appreciate it.
Okay.
Thank you, Dr. Tammy.
Ready to talk about moms and babies at any time.
Absolutely.
Sorry, Patricia.
It's okay, Dr. Timmy. They're going to get my slides in a second. Good morning. The advantage of always going last. Should be better in service. Okay. Well, without slides, you have them in front of you. So we actually begin on page 68. I will tell you while she's getting up those slides. Our first 2 programs, we have no difference between what the governor has recommended and the House has recommended. Those are all the specific administrative services, kind of puts and takes for our department. The only The only slide that we really have some changes from the House is on page 70, and that's our Georgia War Veterans Home. Thank you for approving funding in the amended budget for our subacute therapy unit, as well as our increase in funds based on healthcare costs. If you look at number 376.3, that specifically was in the wrong program. That was for an increase in the teacher's retirement system. That was in our cemetery program, was moved to the house, or was moved to our homes, and that was approved by both OPB and the House in the tune of about $63,000. It was just in the wrong program. Again, based on what was approved in the amended budget, we have an increase for funds in our baseline budget to address the rising cost of healthcare, specifically in our Georgia War veteran homes. That is based on a year's worth of increased costs, and would keep our bed count at the same number. On 376.5, that's a 40-bed increase that the House has recommended. That ends up being about $53,000 per patient annually, to the tune of about 2.1%. We had asked for 100 beds, which would take us to 90% occupancy, which is what the VA requires. However, we understand the House is looking for us to see if we can increase that 40 beds, and we do have a program and a plan to provide to both them and you by the 1st of September on how we're increasing beds, because we've only ever decreased beds over the last decade. The challenge with not meeting that 90% is we have to bear some of those costs as a state. If we're at 90%, the VA pays our bed hold days, or the number of days when a veteran goes to a hospital. If we're under 90%, we have to pay that cost. You can see in the notes that the state actually only pays about 35% of the cost for our care in the nursing homes, and the rest of that is based on our federal match as well as patient fees. And you don't have the slides, but if you go to probably the very last slide before the questions, you can see that we've got 486 beds. We're at 54% occupancy, and so the additional 40 beds that the House has recommended would put us about 64% occupancy. And overall, we're meeting about 13% of what the VA says we should meet in our skilled nursing beds. And you can see how we compare to the states around us. And with that, I'll take any questions.
Any questions from the committee?
And I did want to point out, for the first time ever, we have given you our state resource guide from Georgia Department of Veterans Service. This was produced, I would say, by donations and not through state appropriations.
Great, thank you so much. We appreciate that. Sorry for the going last. I guess the V and the veterans, I get the feeling, as Watson also goes last many times too. I get it. So thank you very much. Meeting's adjourned.